This is an exciting place because at this moment, there's a great opportunity that Governor Pritzker has provided to get the public vaccinated. One more opportunity for us to move closer to telling our post-pandemic story. I say this often, but it's really true that we all owe Governor Pritzker a huge debt of gratitude for his steadfastness in working diligently to keep Illinois safer. Through his efforts, Illinois has become a national model in coronavirus response, and for that we should all be very glad and thankful. I know we are all experiencing pandemic fatigue. We have been socially distancing and Zoom meeting for over a year, but we really are getting closer to what will be our post-pandemic new normal. And the availability of vaccines through this facility and others throughout the state is a huge reason why. The Illinois State Fairgrounds vaccination site located here in the Orr building is easily accessible. Everyone knows how to get to the fairgrounds. It's on a mass transit bus route, and the SMTD access van is also available. There's parking right outside the door, and you don't need to live or work in Sangamon County to come here to get your vaccination. It truly is available to anyone and everyone, no matter where you live, work, or play. The process to secure an appointment is as easy as calling 217-210-8801 or visiting the Sangamon County Health Department website at www.scdph.org. Vaccinations are available by appointment from 9 a.m. to 3:30 p.m. Tuesday through Sunday. And that's very intentional because that means weekends are available for those who are working or for whatever other reason cannot come during the week. I actually went to the website to try it out, and it's literally 3 clicks and you have an appointment. So it really is as easy as 1, 2, 3. I urge everyone to take advantage of this opportunity. Getting as many residents as possible vaccinated is a huge step toward reaching a more normal tomorrow. And for those who may be experiencing some vaccination hesitancy and you have not decided whether you want to get vaccinated, I urge you to get vaccinated. I have been vaccinated, my husband has been vaccinated, as well as my sister, brother, and my son, who is a high school basketball coach. And now Governor Pritzker is going to follow suit. So do it for yourself, do it for your family, and most of all, do it for your community. I'm challenging everyone to be an example for your family and friends to follow by getting vaccinated and go all in Illinois. And now I bring you Governor Pritzker.
Thank you, Senator. Well, thank you very much to Senator Doris Turner. She's doing a terrific job representing her constituents here, and of course, this is not her first time here at the Fairgrounds and at this mass vac site, and we appreciate her encouraging everybody to come and get vaccinated when it's their turn. Senator Turner, I want to say how proud I am to stand with you, and was yesterday too, as we signed the Illinois Legislative Black Caucus's economic pillar into law. And what an honor it is to be with you again today here with the National Guard, who are running such an outstanding operation for not just Springfield, but for all residents in Illinois. Today we're joined also by Illinois Emergency Management Agency Director General Alicia Tate-Nadeau, who runs one of the agencies full of unsung heroes. General Tate-Nadeau has provided incomparable leadership, battling not just the pandemic, but floods and extreme cold and any other emergency that nature throws at us. And this state is truly grateful for her service. My friends, this virus has taken a toll on all of us. Each and every resident of Illinois has experienced enormous loss of a loved one or a friend, of a tradition, of work, or of just the tiny little joys in life. Sacrifice abounds. As we look ahead with hope for post-pandemic normalcy, it's not lost on me the price that we've paid, nor the collective mourning that we all still owe ourselves to embrace. We really do have a fighting chance now to bring this pandemic to an end. We have 3 incredibly effective and protective vaccines that will protect people from getting very sick, prevent them from needing to go to the hospital, and will keep people alive who would otherwise pass away from this virus. Many, many years of development of medical technology has allowed the expedited production of safe vaccines to fight COVID-19. And thanks to the great work of President Biden's team, our weekly vaccine supply to states has more than doubled since January. Of course, as one of 50 states, Illinois cannot overcome a national vaccine supply that still hasn't caught up with demand. But we can make it as easy as possible for residents, particularly from historically underserved communities, to access this vaccine when it's their turn. That's why we have more than 900 vaccine locations all over Illinois, including National Guard operations like this one here at the Fairgrounds, but also trusted community providers like FQHCs, federally qualified health centers, and critical access hospitals. And in addition to our online vaccine finder at coronavirus.illinois.gov, we have a statewide vaccine hotline to make appointments for those who don't have access to the internet. And I'm hopeful that everyone in the media will help us get this number out. The number to reach for the vaccine hotline is 833-621-1284. I'm going to repeat that, 833-621-1284, for people who want to make an appointment by just calling and getting a little bit of help to do so. That line is staffed from 6 a.m. to midnight every day of the week, 7 days a week. As of this morning, Illinois has administered over 5 million vaccinations, reaching 66% of our 65 and over population, as well as nearly 1 in 3 of our residents who are age 16 and over. I'm deeply, deeply grateful that so many of our residents have embraced this life-saving protection. But I also want Illinoisans to know, especially those who may not yet feel confident enough to get vaccinated, that I'm not asking you to do anything that I wouldn't do myself. As a government worker, I'm eligible, and so just a few moments from now, I'm going to get vaccinated here at the Illinois State Fairgrounds mass vaccination site. Look, I'm not a doctor, but I trust doctors. And thanks to the great work of our doctors, researchers, and public health scientists, these vaccines offer us all the fastest way back to normal life. I'm so excited to get there and to protect my family, my friends, and my coworkers. Before I turn it over to our final speaker, I want to thank the incredible men and women of the Illinois National Guard here at the Springfield Fairgrounds, at our mass vac sites and mobile operations across Illinois, as well as all of those who led our COVID-19 response in the early months of this pandemic, setting up testing sites and delivering PPE to hospitals and frontline heroes all around our state. In fact, many of them have deployed to fight the pandemic not once, not twice, but multiple times, embracing the uncertainty and the difficulty of the last year in order to courageously protect all of our communities. Please join me in giving our Illinois National Guard a big round of applause. Thank you, and with that, I'd like to turn it over to our Director of IEMA, General Alicia Tate-Nadeau. General?
Thank you, everyone, and thank you for being here today. I'd like to start off today by saying thank you to the Sangamon County Health Department Administrator, Gail O'Neill, who has been an instrumental part of all of this and a fantastic partner as we fight this pandemic. I'd also like to take an opportunity to thank Governor Pritzker for his steadfast leadership throughout this pandemic. Last year, Governor Pritzker directed the Illinois Emergency Management Agency and our team at the State Emergency Operations Center to process and come up with a plan to vaccinate and to ensure that as we have expanded federal vaccine supplies increase, that we could rapidly get the vaccine in people's arms. Across the state, the governor has deployed more than 1,400 National Guard troops to stand up and support mass vaccination sites throughout the state, such as the one that we're here today. Today, we have 86 Illinois National Guard vaccine teams deployed throughout the state, and more than 700 personnel have been assigned to fix vaccine sites like the one here that you're currently at. We currently have 14 sites that we refer to as mass vaccination sites, and they're open to all eligible Illinoisans, regardless of your zip code, regardless of your immigration status, and regardless of your ability to pay or health care insurance. The vaccine is free and available to you. The men and women of the Illinois National Guard are the driving force behind our mobile vaccination support teams. Today, there are 15 mobile sites supported by the state of Illinois and staffed by nearly 500 Illinois National Guard personnel. And they have one goal in common. Their goal and mission is to help local health departments reach underserved communities and increase accessibility. This past weekend, our troops reached a significant milestone. You heard the governor talk about the 5 million shots that we have put out throughout the state. Our Illinois National Guard has been responsible for over 500,000 of those shots going into arms. And I have also heard many of you in this same setting today thanking us for what the National Guard is doing, what our state is doing, and bragging about the organization, the efficiency, and the friendly environment that these type of mass vaccination locations provide. As a retired Brigadier General in the Illinois National Guard, let me say that I'm proud of our work and what we've been able to accomplish. I think everyone should be proud of our citizen soldiers. So here's what we know. The vaccine is here. Our allocation from the federal government continues to grow, and with that, the eligibility has expanded. And the vaccine is here, and that means hope is here. So here's my ask of you. If you have received this safe and effective vaccine, please talk to your friends and family about how friendly and efficient it was and the process here at the state mass sites. Because together, whenever we're all vaccinated, we all have hope and we resolve. With that, I will turn it back over to the governor.
Happy to take questions from members of the media.
Governor, the positivity rate is on the rise in some parts of the state even now.
Yes.
I think I saw Chicago warning people not to travel if they haven't been vaccinated. What do you make of that idea of a vaccine passport? Would that be something to implement at the state level?
Well, those are two unrelated things. I just want you to separate them. A vaccine passport is really a reference to something that would sit on a device that you have that would show that you've been vaccinated. Separately, I know that the city of Chicago has travel restrictions, and so. But to the question about some sort of app that allows you to show people that you've been vaccinated, there's nothing wrong with that if it's your choice. As long as it's your choice, right? And if people ask you to show that for a particular venue, a private venue, they have the ability and right to do that. You don't have to show that to them. You don't have to go to that venue or be engaged in that activity either. I do like the idea, though, that everybody will have with them easily on their device. Most people carry their devices with them, some way to show that they've been vaccinated. Look, your friends, your neighbors, when you all want to get together, you may also want to show each other that, hey, it's okay, we can take our masks off as is directed, the CDC is allowed, as long as the group of people getting together have all been vaccinated. So I think it's an interesting other way to show people that you really have been vaccinated.
What did you make of Indiana, Governor Holcomb removing the mask mandate?
Well, in my view, we need to get much closer to herd immunity before we start talking about people taking their masks off and nobody wearing a mask. I think it's very important for us to continue to do that. Remember, only a third of adults have been vaccinated. So we're not anywhere near herd immunity yet. So it's very important that people keep their masks on, stay safe until they've been vaccinated, until we get so many more people vaccinated. As I understand it, the city of Chicago, which is responsible for the vaccinations at Loretto Hospital, is engaging in that activity. They are looking into it. If it's an inadequate investigation, I could certainly see that others might want to look into it. But let's be clear, people who are the administrators of the vaccines need to be responsible, need to follow the rules that have been set out, the guidelines that have been set out by the state, and in that case also by the city. And as the city has done, has said, if you're violating those guidelines, you shouldn't be getting vaccine to give out until we can prove that you're following the guidelines. So I think that's a reasonable way to operate. Sorry. I can't hear you, I'm sorry. Look, right now we're on course. We're still following the guidance that we've set out for everybody. If for some reason we need to halt and move some region back into a previous phase because the numbers are going way up and beyond the guidelines that we set out for those phases, then we'll have to do that. But that's not where we are now. If Chicago breaches that level, is that what you're asking? Yeah, I mean, it's just like any other region that we've had in our plan. That's something that we would look at. I mean, I don't expect us to get there, but I've been to this movie before and seen, the rising positivity rates, and I'm concerned about it. And I've been saying all along, even as we have addressed the mitigations and tried to lower mitigations here or there, I've said we got to be careful about the variance, and I am concerned. I must tell you, as I see numbers go up, is that the variance, or is it a blip in the data? What is it exactly? So we'll keep watching very closely. But I can tell you, there is more activity going on, and I think people maybe are being a little less careful. And I want to remind everybody: please keep your distance. Please continue to wear your mask. Please be respectful of others. Dean. I happen to be here, Dean. Honestly, I'm here for the legislature is in session, and as I have been when the legislature is in session, I'm here in Springfield, and so it just was convenient for me to do it here.
And have your family members been vaccinated yet?
No.
What kind of vaccine are you going to be getting?
What they're giving today here at the mass vaccination site, which is the Johnson & Johnson vaccine.
Governor, how can Illinois voters trust a map that doesn't have the full census data?
Well, because we know an awful lot about the data of population movement and so on. Look, it's not Illinois' fault that the Census Bureau isn't prepared. It was the previous administration and COVID that both played into this problem. We have deadlines to meet, and so there's great data out there to be used. I know the legislature is looking at that data now.
You only have to wait 90 days to get it right for the next decade. What's wrong with waiting?
Well, again, there are sources of data that are being used that are they've been used by the Census Bureau itself. And so I think those are reasonable for the legislature to look at. And again, decisions about that will be made over the next couple of months by the legislature. Many of them have been consulting with me as well. Mike. I'm sorry, are you still concerned? Yeah, it's a great question. The answer to the question is that some of the federal pharmacy partners and others who are, outside of the LHDs, the local health departments, and outside of, the purview of IDPH, sometimes don't report on time. And as there has been a much greater influx of vaccine that's gone to those partners, they haven't been able to keep up with entering the data in our systems. So you've even seen an adjustment in the numbers over the last couple of days. We're trying to make sure that as that data comes in, it gets put into the system and you can see all of it. But suffice to say that we've been at about 100,000 for a number of really a week and a half, I believe. And as I have said before, March 29th is a date after which the federal government has said we're going to start to see more and more Johnson & Johnson vaccine coming to the state, and that'll allow us to significantly increase the number of vaccines given per day.
All right, thank you, everyone. Thank you. You're going to get a shot now.
Has the Biden administration what? What they've sent to us, I mean? Yeah. Yes, the Biden administration has done a good job following through. They have increased vaccinations every week that they've been in office. Thank you. 700 vaccinations she's done. I'm an expert. Fine. Yeah, not a problem for me, but I know that there are some people that are not so much vaccine hesitant as needle hesitant. Okay. That means I got orders in front of me for 5 minutes. This is the one question that I have, and my wife has. First of all, I think you've seen that many people have tried to live in gates around the governor's mansion in honor of those that were lost. And I'm pleased that it's something that people can come and honor their loved ones or even those that they don't know that they've lost. And my wife, of course, who had the idea to do this, it's really her project. So she's really pleased to see so many people come by and take their responsibility. I didn't hear any. Sorry, it's just so loud. Oh, well, it's privately paid for, so. How are you feeling? Feel great. Same as I did when I walked in, but, fortified.